I'm Mary, I'm the ward receptionist here on SCBU, and I'll be the first face you see when you arrive on the unit. Parents have to buzz in when they arrive on level G. We like to call parents by their name, so we get used to seeing them each and every day, and then we get to know the babies when they get named, so it's like a little family.
A special care baby unit is for babies who do not require intensive care. Our SCBU has 10 cots. We have 4 high dependency incubators behind me for babies requiring high dependency care. We have 6 low dependency cots for babies who are requiring tube feeds and waiting to grow, and we're preparing them for discharge. We also have 1 side room for babies coming back from other units or other specialist center. So we admit babies born at 31 weeks gestation and over, weighing at least 1.25 kilograms. On admission, your baby will be cared for in our high dependency area, where your baby will be monitored 24/7. We have specialist nurses who are qualified to look after your baby should he or she require ventilatory or respiratory support. Once your baby is off the IV drip, IV fluids and monitor, we will move your baby either back to you on postnatal ward or into our nursery too, where we would help you establish more breastfeeding and help you prepare for discharge.
If mummy's sick in bed, we can email babies being fed, etc. So mummy's participating in that even though she's not physically here.
Usually the babies in nursery 2 are being looked after by nursery nurses. So on a day-to-day basis, you'll see 3 nurses per shift. You've got 2 qualified nurses who are trained to look after very sick babies, and 1 nursery nurse. And this is depending on our acuity. If we are busy, if we have more babies, then you'll see a lot more of us.
You are part of your baby's care, and we have you as a family unit. So we will treat you in partnership with your baby. So we expect you to be here and care for your baby, and we will just give you support to do that. When we go round and do our ward rounds every day, we try really hard not to interrupt things like skin to skin care, or if you're breastfeeding your baby, we will kind of work around you.
Okay, have you got any concerns at the moment?
Mama's got lots of breast milk. Well done.
Excellent.
Good. Well done. It's really good for your baby's brain development.
So it's lovely if you're there present on the ward round so that you can be really involved.
The facilities would include bed chair that you can just use so that mommy can sleep overnight. Parent kitchen as well. So when babies are staying in SCBU, then we would like to make our parents feel that's an extension of their home. So we have family room, then we can have the sibling there. They can play, allowing mom to bond with their babies, allowing mom to have that uninterrupted time with breastfeeding. We also have a rooming in room for both mum and dad to stay before going home.
My role in SCBU is to offer a sort of therapeutic space for parents with their babies, just to express a space just to express any worries and feelings about their journey that they've been on. And the idea behind that is to support a loving bond between themselves and their baby. Let's talk about whatever's on their mind, hear their worries and offer a listening ear.
The nurses will help you do as much as possible to care for your baby. So we'll encourage you to be involved in your baby's care with nappy changing and feeding. We want to prepare you as much as possible so that you feel confident when taking your baby home.
So the best thing you can do for your baby, and only you, is to express breast milk. So we cannot overemphasize the benefits of breast milk for a baby that requires special care. All staff on the Special Care Baby Unit have been trained to apply the Baby Friendly Initiative standards, which includes supporting you with the initial expressing and also continuing with your lactation journey, helping you to respond to baby's feeding cues and find a way that you can both feed comfortably, get to know each other and be ready to go home as a family.
I'd like to reassure you that we are here looking after your babies, and for you as well to feel that you are welcome, you have 24-hour access to your baby, and we are your second family. So welcome to our unit.